Many years ago, a physician was hired by a major hospital. The facility specialized in liver transplants and had a waiting list that extended beyond a year. Due to the often rapid progression of symptoms in patients suffering from end-stage liver disease, many did not survive long enough to receive their transplant. As a solution, the hospital commissioned this doctor to implement therapies that would keep patients alive long enough to get their transplant. He created a protocol containing 3 key nutrients, and his results were amazing. Not only did patients show improvement in their labs, a reduction of liver inflammatory markers and hepatitis antibodies, but many actually enjoyed a full recovery and withdrew from the transplant list. Their liver disease was reversed, cured, and they enjoyed complete and total recovery, naturally. Unfortunately, patients getting better and getting off the liver transplant list is bad for the liver transplant business, and the doctor was let go. But his wisdom was not lost. A medically trained and licensed naturopathic physician is trained to identify and treat the root cause of disease, and we use therapies like this doctor did to help our patients enjoy true recovery. Recommendations from naturopathic physicians are gleaned with respect to the ancient wisdom and conventional research that's available. If you or anyone you know is suffering from liver disease, the following 3 nutrients may be life-saving. This video and the article included with this video summarizes what that doctor used. And of course, as always, this is education, and so if you find that this may be interesting and valuable for you, always talk to your trusted doctor before making any changes to your protocol. These 3 nutrients for liver disease are just the beginning in the therapeutic possibilities that will help you to recover from hepatitis, cirrhosis, NAFLD, NASH, autoimmune hepatitis, hepatitis C, B, and more. Of course, before starting a new supplement regimen, make sure that it's appropriate for your unique situation. Let's get started. The first supplement I want to talk with you about is called alpha lipoic acid. Alpha lipoic acid, or ALA, is an antioxidant that powerfully reduces liver fibrosis that is associated with hepatitis. Hepatitis is liver inflammation. ALA can promote liver regeneration and can reverse liver cirrhosis, which conventional medicine has previously considered to be impossible. Alpha lipoic acid is fat soluble, which means that it can penetrate deep into the cells of the liver to exert its healing effects. Make sure that when you're buying alpha lipoic acid that you get the R form. The R form is the form of alpha lipoic acid that is biologically active and has the antioxidant properties. The S form is a chemical that is made in a laboratory. The S-lipoic acid form is found in cheap or lower quality supplements and is generally ineffective and biologically inactive. The typical dosage of R-lipoic acid is about 250 milligrams per day. The second nutrient that this doctor used is called selenium. Selenium is a powerful nutrient for healing hepatitis, cirrhosis, and liver disease. Selenium is a brilliant natural element that is key for liver disease, reversing liver cirrhosis and healing hepatitis. It acts by detoxifying liver enzymes and by maintaining the glutathione antioxidant system. It's a powerful antioxidant, and antioxidants are used to heal liver cells. So selenium promotes tissue healing, elasticity, and it's anti-inflammatory. Selenium deficiency can increase the risk of liver disease, and therapeutic doses of selenium supplementation will not only protect against the development of liver cirrhosis, but it can reverse it as well. My favorite form of selenium is seleniumethionine, as it is one of the most bioavailable forms of selenium and has a superior antioxidant effect in the body. It is important to dose selenium appropriately, so talk with your naturopathic physician before starting selenium supplementation. That being said, typical dosages are around 200 micrograms twice per day. The third ingredient that this physician used is Silybum, silymarin, or milk thistle. Milk thistle, it heals hepatitis, cirrhosis, and reverses liver damage according to the research. If you have liver disease, you should be considering milk thistle. Milk thistle is an antioxidant. It removes toxins at the membrane level of the tissues. It enhances the production of proteins, which is a key step in tissue regeneration. It's also antifibrotic, which means it removes liver fibrosis. It's an immunomodulator, which means it can reduce the autoimmune hepatitis effects. It's an anti-inflammatory, which is absolutely important in helping heal all forms of liver disease. The Mayo Clinic reports that milk thistle is effective at healing liver cirrhosis, which is liver scarring, which was, again, previously considered impossible. This also improves blood sugar management. It helps reduce liver disease and diabetes. It heals kidney disease, which often co-occurs with liver disease, and it can do so much more. According to the University of Maryland Medical Center, milk thistle has been shown to increase survival in those with liver cirrhosis and chronic hepatitis. This is remarkable, as these studies often do not employ therapeutic levels of milk thistle, nor does it take into consideration the wild crafting and quality control of the herb used itself. So just imagine the efficacy of this plant if they were actually using it to its best standards. This also means that even the low quality of milk thistle is effective. When you're searching for milk thistle, make sure that you select a product from a company that has quality control for the time of harvest of the plant, the part used. For example, the active constituent is psilocybin, and if this was not extracted, the product would most likely be ineffective for you. And that the herb was also not exposed to organophosphates and other chemical derivatives during growing, as all of these will end up going directly into your tissues when you take it. My favorite companies, which I have no affiliation with but love to send people to, are Gaia, Wise Woman Herbals. They're the best. Recommended dosages of milk thistle typically range around 450 milligrams once or twice per day. You can heal from liver fibrosis, NAFLD, which is non-alcoholic fatty liver disease, cirrhosis, hepatitis, and more. These 3 herbs are just the beginning. To learn about the other tools that might be appropriate for you, check out the Liver Support Mastery course and get started on the road to a new life with safe, powerful, and effective solutions today. I've had so many people call and just ask, what can I do? I have a diagnosis. I have these symptoms. This is what's going on. And knowledge is powerful. Check out the Liver Support course. The cost of the course is less than a single visit in one of my clinics, and the information is something you're going to have access to for the rest of your life. You're worth the shot. Try the liver course. You can learn more about it by going to my website, drnicolecain.com, and clicking on the courses tab at the top, and then you'll scroll until you see the button that says Liver Support Mastery Course. You could also order milk thistle, selenium, and alpha lipoic acid directly from my website, or you can find it from your local physician or local health food store. Talk to your primary care doctor or specialist before making any changes. Thank you so much for watching. This has been Dr. Nicole.